You are now in an operating room and a very delicate procedure is being performed on your eye. From the outside everything looks calm and almost ordinary, but inside surgery is being carried out at a microscopic level. The most important detail is this: the patient is awake but feels no pain. Cataract surgery is essentially the process of completely replacing the eye's natural lens, which has gradually lost its transparency over time. In other words, the goal here is not just to fix something, but to restore eye's focusing system from the ground up. Before the procedure begins, the eye is numbed using special drops. Since this type of anesthesia is local, the patient is conscious, breathing normally, and aware of their surroundings, but does not feel pain in the eye area. In some cases, there may be a slight sensation of pressure, but it is usually brief and not uncomfortable. Then the surgeon makes a very small incision in the front part of the eye. This incision is typically around 2-3 millimeters and is small enough that it does not require stitch. Through this opening, microsurgical instruments are inserted. These tools are so thin and they are barely visible to the naked eye. The first critical step is preparing the cloud natural lens. What we call cataract is essentially the loss of transparency in this lens. Normally crystal clear like glass, this structure becomes opaque over time due to protein buildup and aging effects. As a result, it can no longer properly refract light and vision becomes blurry. At this stage, the surgeon uses a technique called phacoemulsification. With this method, ultrasonic energy is used to break the lens into tiny fragments. You can imagine it like carefully breaking down a cloud piece of glass inside the eye and simultaneously removing it using a vacuum system. The entire process is controlled and designed not to damage surrounding eye tissue. Once the old lens is completely removed, a hollow capsule remains. This capsule acts like an initial pocket where the new lens will be placed. Now the most important stage begins: inserting the artificial lens. This lens is called intraocular lens and has a foldable structure. It is inserted into the eye through a small tube, unfolds inside and takes over the function of the natural lens. This artificial lens restores the eye's focusing ability, allowing the patient to see clearly again. Some lenses are optimized for distant vision, while others are multifocal, supporting pulse, near and far vision. The choice depends entirely on the patient's eye structure and needs. Once the lens is correctly positioned, the procedure is complete. In most cases, the small incision sees itself naturally due to its size, so stitches are not required. The eye's internal pressure and natural structures support the healing process. The entire operation usually takes around 10-15 minutes. Also, this can vary depending on the complexity of the case. The most important factor is not duration, but the pressure of the procedure. After surgery, the patient is observed for a short time and is often discharged the same day. In the first few hours, mild blurriness or light sensitivity may occur, which is completely normal. During recovery, the main precautions are simple: avoid anything that could irritate or injure the eye, use the prescribed eye drops regularly, and avoid heavy physical activity for a new few days. Most patients described a noticeable improvement within just a few days, often saying, "It feels like a curtain has been lifted from my eye." This is actually a very accurate description because the haze caused by the cataract is truly gone. Colors become more vivid and details appear sharper. In summary, also cataract surgery may seem complex. It is a highly standard, safe and routine microsurgical procedure in modern medicine. The biggest change, however, is not technical. It is the dramatic improvement in the patient's quality of vision and daily life.